I'm 17 now, and I have spent my entire teenage year watching from a distance because I wasn't able to participate in any normal activity. You feel so down when you know you're in pain and you know how you feel, but then you go and talk to doctors and they're like, oh, you're not in pain. We can't find anything wrong with you, so you're not in pain. Like, it's just you. That's just how you are, and that's just how you're gonna have to live. And it made me and my mom feel like horrible. Some days, like, I broke down at the doctor's office twice because they wouldn't listen. And they didn't understand the amount of pain that I was in, and they just kept wanting to push medicine and, take this pill for the third time, and it might help this time. And it was just defeating.
Evelyn is a hardworking teenager who enjoys working on cars with her dad. However, increasing pain began making her feel as though she may have to live her life as a spectator. That is, until she learned about the Bonati Spine Institute.
When I was about 13, I started getting a really bad hip pain that progressed into my back. Pretty much stayed lower back and hip for a while, then progressed down my legs, mainly my left side. And then probably 3 years after I first got the initial pain, I started getting really bad neck pain, along with migraines, headaches almost every single day. And then my neck pain just got worse and worse. It was really hard for me to do anything. I couldn't sit for long periods of time. I couldn't stand for long periods of time. I couldn't walk around for a long time. And then as I started getting older and I was continuing growing, it got really hard for me to do anything. I actually had to take my sophomore year of high school off and go online because I couldn't physically walk the school anymore due to the amount of pain that I was in on the average day. For modeling, I really had to hope for a good day and hope that I could function and actually get out of bed in the morning in order to, make it to a shoot, or, I'd have to constantly take breaks, sit down, lay down, which really took a toll on that because you can't always just take a break. You can't always sit down when you need to shoot.
When Evelyn arrived at the Bonati Spine Institute, even simple tasks like opening a soda can presented a challenge for her.
Oh my God. I have been in and out of doctors trying to figure out the root cause of the pain. They first did some basic x-rays and they didn't see anything that would catch their eye, so they sent me to physical therapy. And I tried to strengthen my muscles, mainly in my hips, just to see if that would aid in the pain at all. It didn't do much. It helped for a little bit. I could feel the difference in the strength that I had, but it didn't help the overall pain at all. I've tried chiropractic probably 3-4 times for months at a time. My last session that I had was just about a year. And for the first 3 months, I would say it helped a little bit where I could, move. But after that, I would go and get adjusted and I would be in more pain than I was when I first got there. I also was on a million different pain meds for about a year and a half. It seemed like every month they would put me on a different one to try and see if it would help, and none of them ever helped me. So we just, took a step back and we're like, we're gonna not do any meds, not do physical therapy. Chiropractic was like if I needed it, we would go get a little movement in. I wasn't able to exercise at all because of the amount of pain I was in while doing it, or days after. I would be in so much pain, it wasn't even worth trying to work out. And it was not major workout. It was like light, like yoga, no weight, anything. And I was still in so much pain. When I first started going to doctors, there was a lot of hope that we were gonna find something. And you don't want to go into a doctor's appointment hoping to find something wrong. But we got to that point because it became, I was in and out of doctors every week, and I was traveling hours to go see new doctors. Me and my mom went all over the place trying and trying and trying, and no one could ever help. And then my dad, about a year ago, he came down here and got his back surgery, and he was tremendously better. That really brought our attention here to see if you guys could help me because we had such good experience with my dad, and he's a completely different person now.
After seeing the results of her dad's targeted Bonati Spine procedures, she walked into the Bonati Spine Institute hoping she would talk to a doctor that would finally listen to her. While meeting with Dr. Bonati to discuss her case, she never expected what would happen next.
My first day walking in here, it was like, okay, let's hope that this is going to be the last stop we have to make. It was very surreal walking in here, and it was like the feeling of like, okay, this is going to be like my last step. This is going to be where we figure out and fix what's wrong. He actually pointed out my problem areas and what the pain that I should have before I could even tell him what kind of pain I was in. And it was spot on. He knew exactly what kind of pain I was in before I even said anything.
And then goes here. And then goes here. Grabs this. See?
Knowing the doctors at the Bonati Spine Institute understood her pain, she was eager to move forward.
I was very nervous because I don't want to be awake if you're going to mess with my back. But when they went over all of it, and after I was in the room and talking to the doctor and the anesthesiologist, it definitely made me feel a little more comfortable.
The exclusive Bonati Spine procedures are performed using conscious IV sedation, where the patient remains awake and communicating with their surgeon to ensure the source of their pain is eliminated before they leave the operating table.
And it was just, okay, you're done. It seemed very fast.
Surgical guests at the Bonati Spine Institute are often surprised by how quickly they are able to be up and moving after their procedure, without the debilitating pain that brought them in.
It was very nice because I didn't have to lay there for hours and hours. My neck was a little sore, but other than that, I wasn't in pain at all. This is not my arm. No, it doesn't hurt at all. Now, getting up the next day, I usually wake up and I already had pain in my whole left arm from, just about my shoulder all the way down into my elbow, into my hands. And even after the first day of that morning waking up, I didn't have that. I could use my hand without having it cramp up or get numb and tingly. So that was really nice. I can lift up my arms, I can rotate my arms, I can pick stuff up, obviously within reason, but I'm pretty much full strength in my left arm.
Now, just a few days after her targeted Bonati Spine procedures in her neck, Evelyn is surprised by how easily she is able to open a can.
That was easy.
Yeah,
That was a lot easier than it was before. 3 days post-op on my lower back, and I can already feel a difference. I can already move, I can function. I would definitely recommend the Bonati Spine Institute to anyone who has any sort of pain in their neck or any part of their back. I can walk, I can sit. I am already better, and I just had surgery a few days ago. So I would definitely recommend anyone make the trip. It's worth it. It does not matter what you're thinking. The decision to come down here has been my best decision yet. I'm so excited to get home and work on my dad's car. I have been counting down the days to come down here to, get the procedure done and then get home, recover for I'm giving myself 2 weekends. And on the third weekend, I am going to start working on the car with him again. And I'm so excited.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Roku, Amazon's Fire TV, Google Play Store, and Apple's App Store.